Ni hao. That's the extent of my Chinese, I apologize. Good afternoon, TCBM colleagues, integrated practitioners. I am super happy to be here today. I feel normal talking TCBM and acupuncture, which doesn't always happen. So I'm here to talk about platelet-rich plasma. As acupuncture, I try not to talk too much about platelet-rich plasma and talk more about the acupuncture part of it. Now, my population size here says 50. I've been doing this since 2014, and I actually have been treating I have treated 300 to 400 patients. But these 50 patients are the ones that I'm still in touch with. I know for a fact that 5 years later they're still doing well, no relapses at all. So that's why I chose the sample size as 50. So my patient category selection was actually based on the degree of pain. I used to be an emergency vet and I seem to still attract emergencies. So I would suddenly have these dogs come into my clinic just screaming in pain, and I knew acupuncture wasn't an option. As many of you know, some of these fire and wood dogs, you can't get near them on a normal day, and forget it when they're screaming in pain. So those are the ones. And then some of my patient choices were patients with neurologic deficits, because I just didn't want them to progress to a paresis or paralysis. And then I had these kidney yin, kidney yang deficiency dogs, lower back pain, weak on the hind legs, and barely able to get up and move around and panting and really struggling with it. So these are the cases where I felt like, yes, I can do acupuncture week after week and laser, and the owners can come back for monthly treatments, but I really need to fix your pain now and fast. So you can see I'm not very patient. So because I'm considered more of a referral specialty, I get a lot of patients that walk in through the door that have already had CT scans or radiographic imaging. So I'm lucky that way, so I have my diagnostics ready. Very often, I've ruled out a tumor or something, so I'm not messing with platelet-rich plasma and neoplasia. About 5% of the patients that I see are relapses after surgery. Typically, when we inject platelet-rich plasma into an area, the platelets are immediately activated within 10 minutes. They lyse, they break open, and they release a lot of growth factors. The number seems to be growing every year if you look at the journals. I believe it's 300 to 400. I could be wrong. If somebody has a number out there, please correct me. These growth factors in platelet-rich plasma are transformed to a bioactive state. And what these different growth factors do, I'm actually going to move to the next slide so you can see the illustration. They promote healing, tissue regeneration and repair through angiogenesis, osteogenesis, cellular proliferation. They help with bone remodeling. It's super cool, super amazing what they can do. I use platelet-rich plasma a lot. I use it in partial cruciate tears. I've used it in quite a few derm cases. I use it for management of osteoarthritis because then I don't need to use any drugs. And I usually combine it with TCBM currents as well. Now, the centrifuge that I use is the Arthric centrifuge. They're not paying me any money, but I think they should be since I talk about them so much. The Arthric centrifuge is pretty good. It does your spin in a very short time, 5 minutes. And this is the syringe that I buy from them. It's a double barrel syringe with the outside barrel is where you collect the blood, and then when your PRP is ready, you draw it out through the inner barrel. Very quickly, I collect blood from the jugular vein. This one needs only 15 cc's of blood. Certain others, centrifuges need about 60 cc's of blood, and try getting that from a wiggly little pug or a screaming wiener dog. it's impossible. So I go for this because I need only 15 cc's of blood. I collect blood from the jugular. I try to, because your blood collection has to be very smooth. You don't want to activate your platelets. I centrifuge at 1300 RPM for 5 minutes. There's recent literature that states that if you centrifuge it a second time, you actually get a higher yield of plasma. So, clip and prep, just like we do prolotherapy, just like we do gold bead implants, everything's sterile. And then I choose my acupuncture points. Now this is where I want to emphasize that I choose local points initially. When I first started doing PRP for Ivdd, I was just injecting it into the epidural space, and I was, choosing the intervertebral foraminal. And one day I had this eureka moment where I felt like, hey, I know acupuncture and I do regenerative medicine. Why don't I just combine the two? And I really started injecting it into the quad-toe points. That sounded good, quad-toe points. And I did it in Bowie, and I used all the GB channel. And I'm going back to the previous slide. And I found that my success rate escalated when I used local points as well as distal points. Using it in acupuncture points made a big difference for me. I choose my distant points based on TCBM pattern. Now, I haven't really categorized my PRP cases into different patterns. I know I should be, but it's so hard when a dog's screaming in pain and you can't touch it anywhere. You just can't go around looking at the tongue and paws, as you all know. So I'm holding off on that for now. But typically, of course, we see bony B syndrome and we see the kidney yin and yang deficiency. I just made a list of the points and the reason for selection, but you can just go ahead and use whatever points fit your TCBM pattern. Now, in terms of the outcome, it can be quite dramatic. You can see a dog that's been screaming in your clinic, acting totally normal even 24 hours later. I do give discharge instructions to owners. I tell them, please, graded, controlled exercise at 2 weeks, recheck, and blah, blah, blah. But very often, the next morning, I get a video from the owner and the dog is in a park sprinting right through. Like, what do? You gotta just, shrug and say, it's okay, I did what I could. But these dogs still do well, even though some owners may not follow instructions, they do amazing. Some cases do take about 2 to 3 weeks, especially the older dogs with spondylosis. They take a while to show improvement, and that's where some patients is called for. In terms of the duration of clinical improvement, I find that the spondylosis cases are usually 1 year. Sometimes I find I do have to repeat the treatment after 1 year, but what boggles the mind is the young dogs with degenerative disc disease, with the wiener dogs. These dogs do so well with just one treatment. I have not seen some of these guys back for 5 years, and I had my staff call them, no relapses, no pain, nothing. These dogs are living perfectly normal lives without surgery. And of course, no pain management is needed. Once you've done the PRP, you've done it, that's it. Now, I have been going through a lot of journals in the past 5 years, sifting through a lot of literature because I can't go in there and see what my PRP has done, so I need to know. And this is what I found, that it's amazing because we do know that the end plates do not have any blood supply, and the PRP actually increases blood flow to those areas. It opens up the tiny blood vessels. Collagen synthesis when your nucleus pulposus is super fibrosed and dry. And there's actually literature that has shown that your discs increase in height because these dry, desiccated discs get extra hydration from the PRP and they increase in size. This is Blossom or Blossy. It's 4 days after PRP. This woman came to me carrying the dog in a dog carrier, a little long-haired Chihuahua, and Blossom was just screaming. If she would move an inch and she would scream. That's how bad it was. The owner came to me and she said, if you don't do something, I'd like you to euthanize the dog. If you can't do something, I'd like you to euthanize my dog. Now, Blossom was not a candidate for acupuncture. She was a really beautiful dog. I loved her, but she did not like me. So this is Blossom 4 days after PRP.
Sideways.
So as you can see, she's just walking really, really slowly, but she is walking without screaming. And this is Blossom day 10 after PRP. And this is Blossom week 3 after PRP. As you can see, it took a while. And this is Blossom week 4 after PRP, where she's trying to burrow under the pillows and blankets. She hadn't been doing this for 6 months, and the owner was super happy about this. I have a lot of references here for those of you who want to know more about the actions of platelet-rich plasma. There's nothing here about the use of PRP in acupuncture points. I'm sure some of you here must be doing it. And if you have anything to share with me, I'd be so happy to hear from you. But I haven't been able to find anything about the use of PRP in acupuncture points, and it would be great if we could find more literature on that. So, thank you all for your kind attention. It's really been an honor to be here, and I want to thank all my clients who believe in me and we're probably going to be watching me on Facebook because Robert, my husband's taking a video there. And I want to thank them for believing in me and helping me, because I like to push the envelope, and they're helping me push it even more. Thank you. Cheers to you. Thank you.